Are you a perfectionist? What does it look like to you? At some point in our lives, we've all experienced perfectionism in some way or another. It could be you, it could be a colleague or a friend, but it's there. It can sometimes manifest as an insistence on a faultless performance, if anybody knows what a faultless performance is. A fear of making mistakes, a desire to know or control everything, or connecting your worth to the outcome of your work. Healthy striving or a desire for excellence is essential in healthcare. However, in extreme, the qualities of perfectionism can lead to significant stress and anxiety on the individual and on the team. The pressure to meet unrealistic personal standards can result in burnout, reduced job satisfaction, and compromise patient safety and care. Welcome to episode 15 of the All Ireland podcast series, Walk and Talk Improvement. I'm Juanita Guidera, a Programme Manager in the National Quality and Patient Safety Directorate of the HSE, and it's a pleasure to welcome Professor Eva Doherty. Eva is a practicing clinical psychologist and an Associate Professor and Director of the Human Factors in Patient Safety Training, Research and Assessment Programme at the Royal College of Surgeons, Ireland. She's pioneered human factors in patient safety learning and has been awarded a Principal Fellowship by the Higher Education Academy in the UK and an Honorary Fellowship by the International Association for Communication in Healthcare. Today, Eva speaks with us about perfectionism in the workplace and the impact it can have on ourselves, our relationships, and patient safety. Welcome, Eva, and thank you so much for joining us today. At our QPS Talk Time on Civility Saves Lives, you spoke briefly about perfectionism, the prevalence in healthcare, and the impact on our work. And stemming from that, we had a conversation, and out of that came this episode of Walk and Talk Improvement. So thank you for joining us. So as we begin, when we talk about perfectionism in healthcare, would you tell us what is it, and maybe how could we recognise it in ourselves or others?
Okay, thanks, Juanita. And so perfectionism is a funny one, really. It's a multi-dimensional personality characteristic more than a trait. And it's probably, in simple terms, it's got to do with a concern, a preoccupation sometimes, as the name indicates, to do everything perfectly, to avoid mistakes. It can exist in various strengths, if you like, too. So you could be moderately perfectionistic or weakly perfectionistic or strongly perfectionistic. Imposter syndrome, which people are talking about a lot now, that's definitely linked to it in the literature. So it's this kind of fear that, I'm maybe not going to get everything right. I really need to get everything right. Bad stuff's going to happen if I don't get it right. It's complicated as well in that it's linked to the personality trait conscientiousness, but it does go beyond that. There are identifiable personality traits that we all inherit to various extents from our parents, and it is linked to that as well.
Okay. When you say it goes beyond, that conscientiousness, like what is the difference between perfectionism and conscientiousness?
That's a really good question. Conscientiousness would be regarded as a more positive trait, if you like, more adaptive, except in its very highest forms. If somebody is really strongly conscientious, that can cause problems. And the literature has been able to show that it is one of the vulnerability factors for stress and for not getting on well in work. Moderate degree of conscientiousness seems to be really important for success at work, and not just in healthcare now, right across the board. Conscientiousness has more positive connotations, if you like. Perfectionism can be okay in moderate degrees, but it can cause a lot of problems as well.
Okay. Probably quite challenging because when you think of healthcare, it's not something where you can say we can be moderately conscientious when we're dealing with patients and patients' lives. So do we see this sort of in particular areas of healthcare as a challenge or an issue?
Well, in any aspect of healthcare that is going to, have anything to do with performance, individuals are going to feel challenged. But I suppose if we think about it, is there any form of work where performance isn't an issue, probably not is the answer to that, hopefully. But clearly when, you're looking after patients as against Excel sheets, people's lives are coming, are in the equation, and people can get very focused and exercised and concerned. And that can trigger maybe maladaptive behaviors that can have spin-off effects.
Okay. When you talk about maladaptive behaviors, what are you talking about there?
Yeah, so I'm a firm believer in the idea that when our sense of our own competence to do something, well, it becomes threatened, or if we see that coming down the line, that is felt as a significant stress and a significant threat. That's going to trigger emotions in us, probably fear, maybe anger, maybe disgust. And, I think people are not totally aware or well informed of the link between emotions and motivation and behaviors. And so the challenge there is, can we self-regulate, control our emotions, keep our brainy brain engaged, and figure out the best logical thing to do? And I think, we know incivility is a significant problem in healthcare. And I think what tends to happen is, people are not as successful as what is warranted in the particular situation to control or regulate their own emotions. They fly off the handle, and then we know that has very serious consequences for people's performance. I mean, we know that even the work of Chris Turner in the UK and his website, Civility Saves Lives, he quotes American research showing that even being a witness to somebody, losing the plot impairs your ability to calculate things, to perform, makes you less positive towards others, all these things, never mind the person who's actually on the receiving end.
Yes, yeah, yeah. And all of that speaks to the impact that this has on the work and the relationship. Obviously, flying off the handle might be an extreme reaction, but can it be less than that? Like, what sort of impact does perfectionism have on our work and on our relationships?
Well, you're so right there, because there's a lot of work now happening, particularly in the US, funny enough, on microaggressions, these kind of subtle, aggressive comments, behaviors, omissions, very hard to put your finger on, and people working in healthcare, they're very capable people, they can go about things in very subtle ways. They have a real impact on us, and sometimes we're not even aware that we're feeling compromised, but we are.
For many years, when people were going for interviews, you'd hear the question asked, what's your biggest failing? And a lot of people said, I'm a perfectionist, trying to turn the negative into a positive. But it does have an impact on the people around you. So if I was to say to you, how does perfectionism manifest? What sort of behaviors are on the dark side of perfectionism that actually aren't helpful in the workplace?
So it's definitely causes a strain in personal relationships and work relationships. There's no doubt about that. And part of the reason is that perfectionists, not only do they place can place unrealistically high expectations for themselves, but they also expect that from others. And so that can lead to the conflict, to the sense of being judged, the lack of engagement in what's going on. Highly perfectionist people can, they can present as that idea of being a micromanager, where you can't delegate, you're very rigid, you've difficulty adjusting to change. We're all about change in healthcare, aren't we? And so, that can pose a real threat as well. There is some association in the literature, and this is probably the bad news, between, when you say the dark side, things like narcissism and obsessive compulsive tendencies with really high levels of conscientiousness, and also with perfectionism. So it can, it's across the board really, from, mild to severe.
Okay. And in that sort of space, do you think it manifests in bullying?
Yes. Now, not all bullies are perfectionists. However, the experience of being bullied can lead to perfectionism, and there is evidence for that in the literature. And you can see why that happens really, because if you're being bullied, so the way some people will try and react to that is to try and be perfect all the time so that they're not a possible target. But there's no evidence that all bullies are perfectionists, although some are. So yeah, so bullying is more like a wider concept, if you like, but it's definitely part of the picture.
Okay. And is it reasonable to then say that not all perfectionists are bullies?
Yes.
Yeah, that's okay. That's an important clarification for anyone out there that's having a panic attack at the moment. So that's good.
Yeah.
If you're experiencing this, obviously all of those things, if somebody doesn't feel comfortable or safe in the workplace, if they feel that somebody's micromanaging their work, that has an impact on their sense of psychological safety. And we know time and time again from all of that evidence and literature out there that that has an impact on psychological safety, and patient safety.
Yeah,
Yeah.
it's also one of the big factors that have been identified to be really important for staff burnout. Staff people need to have a sense of autonomy. And if that is compromised, if they don't feel they have a sense of autonomy, that's one of the big work factors that predicts burnout.
Okay, okay. And like we have a lot of people, there's a lot of attrition within the health system at the moment, a lot of people, a lot of challenges with retention. So we know that at the moment a lot of staff speak about moral distress in their work. Do you think working in an area where maybe not reaching a high standard of patient care, or there's gaps between how we're working against maybe the healthcare standards, our own standards maybe, or those policies or procedures governing our work, do you think that also has an impact on people leaving the profession?
Undoubtedly, I mean, there is a lot of work being done on that here in Ireland. Niamh Humphreys is particularly prolific on all of this, and that is one of the factors I'm pretty sure that she's identified. I do think, though, another factor that predicts people leaving is, the conditions in work, the supports that they feel or don't feel. And I think people, they vote with their feet, don't they? And they decide that my work environment is just not supportive. So, we got very concerned about moral distress and injury during the pandemic. And of course that was a huge, huge issue, but it is still going on. But I wonder myself whether people would cope with that if it was being debriefed effectively, if the supports were there after the fact. I wonder, yeah, I don't know which is the bigger part of that picture. I have a suspicion that it's the lack of support in the work environment and the hours and all the other issues that people report, as being the reason why they're going.
So it may not either be that perfectionism causes moral distress either, in the sense that it's not achieving a standard that we might have in our minds.
I mean, on the face of it, you would think that perfectionism and also probably a high level of conscientiousness. We know that healthcare workers, when any of the big studies have tested their personalities, they always come out with really high levels of conscientiousness. So on the face of it, you would think that the more conscientious of us, also the more perfectionistic of us are going to be the more distressed when we see, imperfect things going on around us. Yeah, so it makes sense. I'm actually not aware of any studies, but I bet you they're out there.
I suppose the thing that comes to my mind is that, if you're in a work environment and you either are the perfectionist or you're working with a perfectionist, more so maybe if you're working with somebody, how do you explore the impact that they're having on your life, they're having on your work life, and potentially that it's spilling over into your personal life? How do you explore that with somebody who is a perfectionist?
It's very tricky, and it's going to really depend on whether it's somebody at the same level as you, somebody at a lower level, maybe somebody at a higher level, and different strategies will apply. I mean, there's a fundamental principle that I know my clients always struggle with at the start, which is we don't have control over other people, and we have to approach these situations with that clearly to the forefront. And it really is about self-protection and assertiveness and using I statements and saying, I'm not happy, or I'm not comfortable, or I think, or I'm concerned. There's a great acronym or a mnemonic from aviation, which is called CUS, which our people like in our training programs. So it stands for C means I'm, concerned about this. if you don't get the right answer, that you're looking for at that point, then you escalate it up higher and you say, I'm uncomfortable. And then the first S in CUS is, this is a safety issue. So that's a higher escalation again. And then if you're still not getting the kind of response that you feel is appropriate, it goes to stop. We have to stop. It's a nice kind of assertiveness tool to keep in mind. If you're in the moment and you're a bit rabbit in the headlights, you're a bit of a loss, this isn't right, it's over the top, and to kind of go, what am I going to say? What am I going to say? And you can say, oh yeah, cuz I'm concerned, and that is you being assertive.
And I do think, that differentiation, sometimes we have that conversation, if somebody's being bullied, that, there is an avenue there for addressing that. And sometimes if it's an actual bullying experience, then the only way to really deal with it is to report it.
Yeah. That's a fundamental principle that differentiates bullying from conflict.
Yes.
I think we are a bit confused about that. We found in our any research that we have engaged with, and this would also be reflected in international research, that when you ask people, are they being bullied, you'll get about 20% in healthcare are saying they're bullied. However, if you describe bullying behaviours, then the incidence can double. So in other words, people don't necessarily see what goes on as being bullying, even though it is. So there are conflict resolution skills that can be learned, which we teach here in RCSI. And then, but the fundamental message with bullying is exactly as you say, you have to start telling. It might be, you might just tell your partner or your friend or your, family member, and you just start getting used to telling. Sometimes that can, bring a resolution of sorts. It's a good idea to keep a journal. We recommend that because you can forget, the ins and outs of scenarios. And then if things, keep going, again, depending on the situation and how possible or impossible it is to approach someone, you may have to delegate the situation, and, you may have to ask a senior person to take on this problem and advocate on your behalf. There's a great app which the Australasian College of Surgeons launched a number of years ago because they identified a very significant bullying problem amongst surgeons in Australia. It's called Speak Up, and it's really good because it's got all the evidence in it. It's got loads of tips and tricks. And in particular, it recommends the idea of what they call a cup of coffee conversation. And a cup of coffee conversation has been shown to sort things out in about 75% of the scenarios, which is pretty good. So you're left then with the kind of 25%, which are more severe, which may require reporting. And as you know, the HSE has systems in place for that. There are confidential conversations that people can have, and even that could resolve the situation. And, it's a long way before you actually are stuck with this situation where you have to make an official report.
Even the Civility Save Lives piece has talked about that, the power of the conversation and making people aware of the behaviour, and that really struck me in that talk time. I think that just sometimes having a conversation with somebody, like 75%, as you've talked about there, it's quite significant.
It is.
There's something about that. Just in terms of the people maybe listening to this, if you recognise the signs of perfectionism in yourself, what should you be doing about it, or what can you do about it?
Again, it depends on how bad the problem is. If you're feeling really overwhelmed, I do have people coming to me who recognize it in themselves and, ask for help. That's at, if you like, the very far end, the very severe end. It's likely that this has been something that they may have been born with these tendencies. They may have seen these tendencies in their families growing up. There may have been difficulties in their family, which has resulted in them, if you like, developing these tendencies even more so. We do know that conscientiousness, again, is linked to perfectionism over time. It can lead to self-criticism in some individuals. It is quite a complex network, if you like, between the two concepts. So But I suppose what I would be saying to people maybe who are listening to this is, have a good look at the way you're thinking. What are you thinking? Are you thinking catastrophically? Or are you saying to yourself, this is the end of the world? If I don't get this right, this is going to happen, that's going to happen, the other's going to happen. It may be that you are, predicting the future in very unrealistic ways, and that is triggering anxiety in you. And you're finding it difficult to regulate that anxiety, and you're wanting to kind of get rid of the anxiety because we're very intolerant of anxiety. It's not a nice feeling, and it's not supposed to be, because it's supposed to warn us about, threats in our world. Served us
Yes.
very well thousands of years ago when we lived in caves, but doesn't necessarily serve us as well, if you like, in modern societies.
Mm.
However, it's about trying to figure out, is this a real threat, or am I creating the threat, in my mind, which a lot of the times is the case. And, kind of having a bit of a heart to heart. This is the essence of cognitive behavior therapy. It's about using your thinking to control your emotions. Because one thing for sure, who of us can calm down if someone says to us, will you just calm down? It's not going to happen.
Can't pretend
That
there and let everything be okay. It just doesn't work.
that never works. However, what we can do is we can be our own best friend, if you like, and we can look inside in our heads and identify. And sometimes you have to write it down because you're not actually too sure what it is you're actually thinking. But just see what is it? Are you anticipating doom and gloom and disaster ahead? And if so, well, that's questionable, because it's highly unlikely that we ever get the future right. If we could, we'd all be lotto winners. So, it's about bringing the focus down to the present. The Buddhists have it right, I think. We have to live in the now.
Now, that self-awareness then sounds like it's absolutely essential that maybe and know your triggers, because I would imagine from the sounds of it that at times of stress, maybe those traits come out stronger for people. Would that be fair to say?
Yeah, I think so. And like in extreme versions, what I always find is, people are making up this association between anxiety and disaster, or the other way around, for no reason. You often find tough things have really happened to these people in their past. It's like the Scouts motto, be prepared. I think if something really shocking has happened to you in your life somewhere along the way, and it might be that you look like you coped with it perfectly at the time, because children do, they don't look like, something is really affecting them when it is. It could be that, you're now going by the motto, forewarned is forearmed. I'm going to make sure I see this one coming. I'm not going to let it get me again. I'm not going to be shocked ever again. And we can be over vigilant, and we can put undue pressure on people around us to buy into our mindset. And perfectionism is a mindset. It's recognized to be that.
Okay. That was something you touched on in the webinar, actually, that sort of sense that it can be an unconscious thing, that even without saying or verbalizing that, people pick it up from perfectionists. I was really struck by that. Could you tell us a little bit about that?
So, I mean, high degrees of emotion are contagious, so they seep into everyone. I'm sure everybody listening will have had the experience of maybe walking into a room, walking onto a ward, or walking into an operating theatre, or walking into clinic, and just getting the vibe,
Yeah.
that there's something going on. We're very intuitive that way. A perfectionist who's feeling really anxious and uptight and worried about some disaster that they're predicting ahead, that they feel like they're not going to be able to cope with, or is going to lead to disapproval. That's another big factor in perfectionism. That can seep into the whole team, and everybody's anxious and everybody's on tenterhooks because of it. Emotions are contagious.
Okay. Do you think we have compassion for perfectionism? And do you think we should?
Well, I'm always a contender for compassion, left, right, and center. I think criticism doesn't get us anywhere. I'm also a great supporter of, the now cliche, which is, people don't get up in the morning and decide to themselves, I'm going to be the most difficult person ever. And, I'm going to make everybody's life hell. And so I would always attempt to try and have compassion and to see and try to understand what's going on for the other, because I think that is the only way we're ever going to resolve conflict, is if we can get into other people's moccasins, as they say, and try and have a feel for it. You have to have a balance, though. You can't let yourself be walked over at the same time, and you don't want to compromise patient care either. So that's when the assertiveness comes into it. That's when it's kind of, there's a line here, and I do have compassion and I do understand, but I've got priorities at the same time. Me and my patients that I'm responsible for.
Yeah, and it comes back to that sense that sometimes the compassionate thing to do is to have the hard conversation.
Yeah, yeah, and do it with compassion. And I
Yes.
think, the great thing about that app that I was talking about, the Australasian College of Surgeons app, is that, they do say when you decide to have this conversation, approach it with very, very low expectations. You're not necessarily going to witness a road to Damascus kind of experience in front of you where the person goes, "Oh, thank you so much. I never realized." And it may be that you don't get necessarily the response that you wanted. However, what the evidence will suggest is that it will seep into people over time, and they'll reflect on it, and they'll kind of go, "Oh, maybe I am, over the top and unreasonable. And what could I do about it?" And so it's more, over time that results are seen, not necessarily there and then. It kind of sits with the other idea of that's in behind the kind of the best models of negotiating conflict, which is always have a kind of a BATNA, which is a best alternative to a negotiated agreement. It's kind of like a plan B. It's important not to go into any kind of difficult conversation with a need for the other person to react in a particular way. It's more about what is important for me to say, that's it. If I get a great outcome, happy days, that's a bonus.
Yeah.
What's my plan B? Why am I doing this? If you need the other person to change in a particular way, you're on very shaky ground, because you can't anticipate, and we don't have direct control over other people. Only people themselves can control themselves.
That's really struck me from the conversation, that you don't have that control. So you really have to disassociate from the outcome and say what you need to say for your own sanity and your own peace of mind. And as you said, from a patient safety perspective, it does have an impact. But there is that piece about waiting to see what comes from the other person. And hopefully that the self-awareness piece will change things for them, but you can't direct that. Just as we come towards the end of this episode, do you have any other advice for people, or is there anything that you think would be helpful to leave people with?
It's kind of, I've been asked this a few times lately, and again, it's something that Chris Turner is a big advocate for, and I think he said it in the QPS talk time. We have alluded to it already, but I really do think if in healthcare, if we could have a focus on being kind to each other, I think we would get a lot further than where we currently are, and trying to appreciate, that everybody is doing their best. Now, their best may not be what we might think is best, but
Yeah.
everybody is doing their best. I think we need more kindness in healthcare towards each other.
Yeah.
We know there's a huge amount. One of your other podcasts alluded to that as well. Like, there's a huge amount of conflict going on in the background in healthcare that is, not helpful, that is not making leading to healthcare being as safe as it can be, and is certainly causing massive stress and burnout for the individuals working in it.
Yeah. Yeah. It comes back to that point that you made about, the emotions are contagious. And I know myself, if someone is kind or goes out of their way to be kind on a particular day, if everything lightens, you just feel, I don't know, a different type of energy in the workspace. And that carries with you. And you, whether you want to or not, it just passes on to the next person, because you're likely to carry or pay that forward. So yeah, I think that's a really, really nice thing to leave people with.
I think that's right. And, I'm very interested in emotional intelligence and self-regulation of emotions. And I do think when you're heading into work, regardless of and this is tough to say, I suppose, but you have to put your work face on. You have to almost get yourself into the right mood. Even if
Yeah.
it is, you've just had a big argument with somebody at home or something like this, stomping into work, because, you're feeling in a bad mood. I think we have responsibility, to self-regulate and put our work faces on, greet people with smiles. And now I know, like, that's tough. And sometimes people can have important, significant mental health issues going on, and that's different. But in the main,
In the main, yeah, I think it's really important to acknowledge that as well. Yeah, because that it's not always that easy. And I think there's something about that if you're finding that it's difficult to put that face on when you're coming into work, that it might be time to maybe access some of the resources that are there to support you at those times when it's that difficult,
yeah.
so that you're minding yourself. You can't pour from an empty cup. So look, thank you so much for your time. As always, it's a pleasure. I learn something every single time we talk, so thank you. And hopefully we'll have you back in the future again on other ones.
Delighted, Juanita. Thank you so much. I enjoyed the chat.
Thank you. As we come to the end of this episode, exploring perfectionism in healthcare, its impact and prevalence, I'm struck by Eva's words on kindness. The double-edged sword of perfectionism is that while it may drive us to excel, it can also burden us with the endless pressure, leading to imposter syndrome, fear of making mistakes, strains in our personal and work relationships, and impacts negatively on patient safety. Ultimately, as Eva said, we need more kindness and compassion in healthcare towards each other and ourselves. That might mean having a plan to start a conversation or knowing where to go for help if you're feeling overwhelmed. But it also means being self-aware and gentle with ourselves when we hold up the mirror. If you've enjoyed this podcast, you may be interested in our next episode of the Walk and Talk Improvement series on how an incident in theatre led to revolutionary changes in clinical audit at Sligo University Hospital. This episode was co-produced with Juanita Guidera and Sheema Lughmani, HSE National Quality and Patient Safety Directorate.